My fourth placement has been located within a rural town in a community mental health setting. The placement is an interprofessional fieldwork opportunity ensuring students have the ability to converse with current staff and other students from different professional backgrounds. Whilst I have been mainly associated with the newly established day therapy program, I've had the opportunity to liaise with other teams within the community mental health building. The following case study is based on a home visit I completed whilst working with the senior mental health team. Based on the initial information I received, I selected the model of human occupation to guide my practice. Greg is a 54-year-old gentleman living in a rural centre within the Great Southern region. He enjoys spending time with his mother and sister, being in the community with friends and making social connections. Greg is currently living with the assistance of carers within a supported facility. From a young age, Greg was diagnosed with a mild intellectual disability. While looking at Greg's performance capacity areas, Greg is physically able to complete tasks, but his ability is limited by cognitive elements of functioning, including the ability to initiate tasks, to remember when to complete the tasks, and also he has limited motivation to complete his valued activities. Previously, Greg has been receiving a high amount of support from his sister Faith. Faith has stated that she is being more assertive and withdrawing from her high amount of input within Greg's life, as it is having ill effects on her ability to manage her life and family. This has led to Greg receiving greater assistance from Silver Chain active and private carers. Greg requires prompting to complete the ADL tasks of cleaning, showering, toileting, dressing, and shopping. Whilst Greg is able to partially complete the tasks, he requires assistance to ensure that a suitable level of hygiene and diet is maintained, and that clothing and items are put on appropriately, such as shoes with a heel. He often puts them on without pulling up the heel, which has been causing him to have sore feet, and it increases his risk of falls. Without prompting, Greg is known to go days without a shower or changing his clothes. His family noticed a decline in Greg's memory and attention to tasks. Faith stated that he appears more anxious and has been spending an extended amount of time at his mother's house. A referral was made to the community mental health team to review Greg for early signs of dementia. My involvement was requested as the team felt that occupational therapy input would be beneficial due to the amount of involvement that his sister has with Greg's care and her expressed concerns to his well-being when she is not able to assist him. My role within the session was to gain an understanding of Greg's current functioning and provide the family and senior mental health team with recommendations as to how Greg's functioning might be improved. I completed a Domestic Community Skills Assessment, DACSA, and subsequent report which would enable the relevant environment, person and occupation elements of Greg's life to be included in his medical file. This will assist to determine if a change in Greg's functioning has occurred through either person or environment elements, which may be enabling or disabling Greg's occupational identity and competence as a brother, uncle, son and friend. The first question I've posed to myself is, how did I use professional and occupational therapy specific skills to plan the initial assessment? I feel that when planning my assessment with Greg, that I was able to efficiently utilise the professional skills of verbal written communication, which assisted me to confer with the other interprofessional team. I utilised the skills of efficient time management and respect for others, whilst also being able to synthesise information with occupational therapy specific models, processes and terminology. As stated before, I was contacted through the Senior Mental Health Officer within the practice context of the Occupational Therapy CPPF. Upon receiving the referral, I liaised with the officer regarding Greg's background and the specific information she had on Greg in relation to the reason for referral. Here I was able to gather information such as that Greg was diagnosed with a mild intellectual impairment and that in his younger years, and that his current decline in functioning was congruent with the early signs of dementia. From this, the mental health officer stated that this was all the information she was given, and I was able to take the initiative to request his patient notes, which would be able to provide me with more in-depth information on his medical and social history. I had not yet had to request patient notes in the community mental health setting. This required me to use clear and concise verbal and non-verbal language within the team setting to ensure that I was using the correct forms and that I was given the requests to the relevant people. As I'm on an interprofessional placement, I ensured to ask my peers to enable them the opportunity to develop their interprofessional communication when explaining information and procedures. With doing this, I was able to determine the correct forms to fill in and also the area to submit them. As I'm still a student, I was also able to communicate with my supervisor as to my actions and my request and ensure that she signed off on them to ensure legal requirements were met. Upon receiving the notes, I was able to look through and identify relevant information that would assist my occupational therapy-specific initial assessment and the aforementioned DAXA. As stated before, I used the MOHO with Greg, and this enabled me to look at what environment, volition, habituation and performance capacity enablers and barriers were potentially inhibiting his occupational therapy identity and hence completion of valued activities. Whilst these actions were occurring before the enter-initiate stage of the CPPF, I feel that ensuring I had a thorough understanding of Greg would better enable me to assist him and his family as much as possible. As many resources, including the book Community Disability Services by Dempsey and Nankervis state, it is important when working with people to ensure that the needs of carers are met along with the client, as this increases the carer's ability to continue informal support for the client and reduce the need for the client to move to a care facility, which, whilst having many supportive factors, also has limitations in regards to the support of the individual's occupational identity. I could have improved my planning for the initial assessment further by increasing the amount of research I completed on the early signs of dementia and intervention techniques for low motivation, as these were very significant issues for Greg. In having some relevant ideas on how to work with people in this situation, I think it would have been able to help me guide my interview with the MOHO and allow me to gain a more in-depth view of specific barriers within these areas for Greg, and therefore enable me to provide more suitable advice as to how the issues may be overcome. My second question is, how did the practice context impact on the service given to Greg? There was another number of impacting factors on the service provided to Greg, stemming from the practice context. This included factors in regards to the services available in rural towns and communities, time limitations and available resources, and supportive factors which enable ethical rights and responsibilities to be adequately met and upheld throughout the service. The content of the session with Greg was guided by these factors to ensure that as much as possible was covered and the appropriate plans were made to ensure his ability to remain active in his valued occupations. Being located in a rural centre, there is immediate differences in the practice context in regards to service provision and available resources. Compared to urban services, the community mental health team are able to provide outreach to a greater distance to ensure that all people are met with adequate support. Whilst this is an enabling factor for the provision of supports and ensures that people who are not able to find adequate transport to attend appointments at the centre are still supported, it was also a limiting factor as the time it takes to reach people has increased, decreasing the amount of time that can be spent with any individual. This was evident when working with Greg, as a senior mental health officer had to travel to a nearby town following the session, which required both of us to be very efficient in our questioning and observations during our visit, as we were not able to allow for any overtime. This provided a risk of unethical practice in terms of beneficence, but due to our knowledge that we were only able to visit once, we ensured that our preparation was thorough and that we could confirm that if needed we were able to contact Greg and his sister at a later date to confirm information collected at the initial meeting. It was another support of the practice context that phone calls and email communication methods were supported and encouraged to ensure that provision of services were acceptable. As Greg was only 54 years old, it was unusual for the senior mental health team to accept his referral. Whilst not technically covered by the seniors team, Greg was not able to gain assistance from other services due to the combination of his intellectual disability and early onset of dementia. The practice context was able to overlook the technicalities of Greg's situation and ensure that ethical practice was maintained and ensured that beneficence and justice were upheld, and by providing support for Greg was enabling his and his family's autonomy as to how they might approach his current issues. By accepting Greg's referral and through the completion of assessments, a baseline measure was made. The senior mental health team has now been able to include the relevant information in Greg's medical file, which will further enable adequate care to be carried out when required, and comparisons can be made as if to Greg's functioning has changed. Thank you for listening.